Hello guys, I am Dr. Yogesh, Professor of Medical Physiology. In this video, we are going to see causes, the physiological reasoning behind the clinical presentation, and management of Brown-Sequard syndrome. First of all, let us see the causes of Brown-Sequard syndrome. This syndrome is fairly common. It is produced basically due to hemisection of the spinal cord, that is, cutting half of the spinal cord transversely. This hemisection can be caused by a spinal cord injury, a spinal cord tumor, degeneration of vertebral discs, ischemic changes in the spinal cord, or any infections like tuberculosis. In this syndrome, an interesting clinical presentation is seen, which is a bit confusing to understand. Hemisection causes damage to the ascending sensory tracts and descending motor tracts. The clinical features are observed one or two segments below the spinal cord damage. To understand the complicated signs and symptoms, we should have the very basic knowledge of sensory and motor tracts involved in the hemisection. So, let us see the simplified illustration explaining these tracts. First of all, we'll see the sensory tracts. These are of two types, crossed and uncrossed. The anterolateral spinothalamic fibers enter the spinal cord and cross to the other side of the midline. These fibers carry crude touch, pain, and temperature sense. Then the dorsal column tracts, also called fasciculus gracilis, that is tract of Gall, and fasciculus cuneatus, that is tract of Burdak. They do not cross in the spinal cord but in the medulla. They carry fine touch, tactile localization, tactile discrimination, vibration, proprioception, and stereognosis. Then the motor tracts, that is corticospinal tracts, which carry motor signals without any crossing in the spinal cord. They do cross in the medullary pyramids. If you learn these facts, then you can easily understand the clinical presentation of this syndrome in the following illustrations. Now we'll see about the sensory loss. As you can see in the illustration, if the hemisection is on the right half of the cervical segment, it will interrupt the sensory signals through the anterolateral spinothalamic fibers. These fibers arise from the left side of the body and decussate to the right side after entering the spinal cord. So, there is loss of crude touch, pain, and temperature sense on the opposite side, that is, on the contralateral side. With the same hemisection in the cervical segment, let us consider the uncrossed dorsal column tracts. There is an interruption of sensory signal conduction from the same side of the lesion. So, such patient gets loss of fine touch, tactile localization, tactile discrimination, vibration, proprioception, and stereognosis on the same side, that is, on the ipsilateral side. Lastly, let us see regarding the motor loss. Consider the corticospinal tracts, also called pyramidal tracts, with no decussation in the spinal cord. Due to the same hemisection on the right side in the cervical region, there is loss of motor functions on the same side, that is, on the ipsilateral side. Thus, the patient's right side gets paralyzed. Finally, for the management of the patient with Brown-Sequard syndrome, treatment of the underlying cause is very important. Then, corticosteroids are given in high doses to reduce the inflammation by suppressing WBCs and decreasing the capillary permeability. Thus, in this video, you must have noticed that the physiological reasoning behind understanding Brown-Sequard syndrome is nothing but the knowledge of crossing of the sensory and motor tracts. Thank you for watching the video.